Hello, my name is Olivia and my presentation is on arthritis, the nation's #1 cause of disability affecting nearly 600 million adults. So coming down to the middle, to the middle of our brochure about your joints. On the way on the left side, the joints form where two or more of the bones of the body meet to facilitate a movement. This is your knees, your hips, your shoulders, your wrists, your fingers as well. And then in the joints, there are tough bands of connective tissue that hold the joints together, as well as a cartilage right in between the meeting of the bones to provide a cushion when there's a shock or a force applied. The joint itself is also enclosed in a capsule with fluid that lubricates. That fluid's called the synovial fluid, and then that also provides an additional cushion for impact. You can see a picture of that joint right on the top there. So this blue color, the darker blue is the synovial fluid. The lighter blue right in between the bones is the cartilage, and then the white on either side is going to be the connective tissue. Right in the center here, what is arthritis? So arthritis occurs when there is a swelling or a tenderness in the joint that's caused by the cartilage beginning to wear away, and then the shock or the impact that is usually absorbed cannot be absorbed as well as before. There's different stages of arthritis as well that practitioners see in categories and categorize patients into. So stage 1 is the softening of the cartilage. So as I mentioned before, that cartilage is that light white piece right in between the two bones. So that cartilage starts to soften. When you look at it in MRI, there's no visual change, but patients start to feel some symptoms. Stage 2 is a fraying of the cartilage, which the MRI shows a little bit of a fuzziness in the cartilage. Moving into stage 3, there's a fissuring of the cartilage, which the MRI shows little tiny cracks resulting from the pressure between both bones. And then stage 4 is when there's exposed bone. So that's where the cartilage in between those two bones is totally gone. And you have that bone-on-bone feeling, whether it's your knees, your hips, or your shoulders, but the range of motion is severely decreased and you have a lot of symptoms too. So generally, patients are going to feel some pain, stiffness, swelling, decreased range of motion. And that picture down the bottom here is just the red pieces that you see. Those are the joints that arthritis usually affects. So you see some hand, shoulder, hips, knees, fingers as well. Shoulders. I think I already said shoulders. On the right-hand side, you move into the exercise part. So according to the ACSM's guidelines for exercise testing and prescription, individuals with arthritis can generally tolerate an exercise test, but it's symptom limited. So as soon as they feel a little bit of symptom, a little bit of pain, swelling, inflammation, they generally stop the testing. So high intensity exercise is a contraindication. High impact exercises should be avoided as well. They provide too much pressure, too much force on the joint where there's not enough cushion to absorb it. So you have a lot of pain. You have a lot of inflammation that results from that. You should allow an adequate warm-up, and you should monitor pain levels as well, since they might be feeling a little bit of discomfort. The muscular endurance and strength can be tested with standard protocols, according to the ACSM's guidelines as well. And then for your cycle ergometer, that's going to be what we generally recommend for the aerobic capacity testing, just because it's lower impact than a treadmill walk, about 6 minutes for you too. And then muscular strength, you can go with the hand grip dynamometer. And then flexibility can be tested with a sit and reach as well. Then you move into the exercise prescription. Cardiovascular endurance, you should do about 30 minutes, low impact. So that's why I mentioned the biking. You can do walking as well, as long as it's low impact. You're wearing the right sneakers, things like that, about 3 to 5 days a week. Muscular strength, this is a super important part, which I'll mention a little bit later on. Free weight, resistant band, or body weight exercises, as long as they're low impact, they're generally safe. As long as you use large muscle groups and a moderate intensity from 2 to 3 days a week. Then with your flexibility, you should go for dynamic movement through as much of the range of motion as you can without pain. They're going to be severely limited, patients with arthritis, in the range of motion, so as far as you can get without feeling painful. And that's about 5 days per week. Then moving into the back of the brochure here, left-hand side, is some important information and considerations. Arthritis negatively affects the range of motion on a joint, so flexibility training is really important to make sure that they can maintain everyday living, everyday activity movement. So whether it's going up the stairs, getting into their car, picking up their kids, picking up their grandchildren, going grocery shopping, those are movements that are realistic and they need to be able to maintain. So flexibility is really important for that. That leads me right into the next point as well. The joints in arthritis can become severely unstable. So because of that, with progressed arthritis, you have a high risk of injury, a high risk of falls, high risk of tearing some tendons or ligaments as well. So it's really important to do a lot of strength training, especially around the muscles in the joint. So if you're severely arthritic in your knees, it's really important to strengthen your quad muscles or your hamstring muscles or your calf muscles as well, because then you're going to provide yourself an area of support in a place where you're losing stability, which is really important. So strength training in arthritis patients is imperative. It's also important to monitor discomfort levels and activities that evoke inflammation and discontinue activity if patient feels too much pain, because 9 times out of 10, when you're performing an exercise session with a patient who has arthritis, as soon as one activity kind of kicks off that pain level for them, they're set into a phase of severe pain, severe inflammation that usually takes some time to go down, some time to come back from. So anytime you have any exercise or activity that evokes that, then you should stop immediately. And then the most common forms of arthritis here, there's 2 of them. And these 2 are showed in pictures on the first page all the way on the right as well, on the bottom hand. So all the way on the left picture is a healthy joint. The one in the middle is the osteoarthritic joint. This type of arthritis that you see here, I'm going to circle it for you. This one is the osteoarthritic joint. In this case, it's progressive, local, and degenerative. It affects most commonly the hands, hips, spine, and knees, and it's usually due to being overweight. You can have a genetic disposition, aging, or certain occupations that have really high impact activities. And then the second one is going to be the rheumatoid arthritis. That's going to be all the way on the right. That's that red part here. So in this case, you have a chronic systemic inflammatory immune disease. Generally, the cause is unknown, so they can't really tell you why it's developed, but it develops quickly and causes severe pain. So in both cases, you have severe decrease in range of motion, swelling, inflammation, pain, things like that. But they're caused by different things. And the reason why they develop are different, although they develop generally the same way. So that's the end of my arthritis presentation. Thank you for listening, and I have my works cited right in the center too. Thank you.